we need everyone. We need everyone to tell their lawmakers that they're not okay with decisions about us made without us, and that those who are actually are the major stakeholders in this conversation need to be heard in direct proportionality to our opposition of this dangerous public policy. So, but please hear this. Our opposition to assisted suicide isn't against some inverse meaning of autonomy that proponents would have you believe removes the so-called human and civil right to die. Our opposition to assisted suicide legislation is against public policy that has been proven to remove true autonomy and promote the unethical uncoupling of disability justice rights from healthcare justice rights by targeting people with disabilities as a population that's better off dead. And that's borne out by the numbers of our informed opposition, which encompasses the breadth and depth of the population of the disability community who, like other populations, we're not a monolith, but nonetheless, we are opposing it as a majority, this dangerous public policy, which was designed from the beginning along negative assumptions with disability bias to target people with disabilities. And so those numbers are borne out in our engagements. So whether it was the American Medical Association House of Delegates interim meeting last November to vote on the AMA's continued position of opposition, or at state houses across the country, we show up at a 2-to-1, 3-to-1 ratio. So, and this despite professional assisted suicide activists' deep pockets and constant campaigning that produce these polls, through repeat messaging that claim this constant, interestingly mechanically derived 70% support percentage, which bears nothing to our witness and nothing to verified participation numbers in the U.S. when accessing California's EO, LOA, and Oregon's DW, Death with Dignity Act. As an example, in Washington, D.C., approximately 24 people have died from assisted suicide. 22 were white, one was Latino, one was Black, and yet proponents will churn out these polls that say it's a 70% support percentage, and they did the same thing in order to represent that marginalized communities of color have a 70% therein and about plus or minus 4% support. Anita is going to be dismantling that shortly. And although we don't have, the multi-million-dollar budgets, what we have is an ocean of evidence that is gaining momentum and persuading everyone we meaningfully engage with that assisted suicide is about removing civil and human rights, not providing them, and that assisted suicide is policy regressive, not progressive, and that assisted suicide is a eugenical ableist hammer designed from the beginning to address the problem of people living lives deemed worthless because of their disability. So we'd like to believe that with new information comes new conclusions. And we're buoyed by any number of developments. That certainly seems to be the stance taken by the American Association of Suicidology, who retired its definition of assisted suicide, which previously distinguished itself from suicide. We say it's not, saying, quote, AAS has taken a concerted effort to review, update, and enhance all public statements and positions on policy and items of interest. AAS's mission to promote the understanding and prevention of suicide and support those who have been affected by it. It is clear that every life matters, which brings us to a definition of assisted suicide. I'll start with suicide because that is the foundation. Suicide is the taking of one's life. Assisted suicide is the taking of one's life with drugs that will cause death provided by the assistance, typically of healthcare professionals. Now, I say healthcare professionals instead of doctors or nurses as a hat tip to the previous mention that we're in a terminological war, and that when expansion happens, it happens by dilution, meaning your training and your standards are lessened from a doctor to a nurse to who knows where the eventual end is, but all under the expanded term of medical healthcare professional, some iteration thereof. And so for our collective memory, another point to remember: assisted suicide is made a rational choice when the person committing suicide has a disability. When
Donald, I don't lose those hours if Donald grabs hours. I don't want him to. I know today he had to come in and cover you. In general, I get the sense he'll scoop up those hours. He needs hours, and then I'll be working for him. Nothing. She was my least favorite. So
Whoever's not on mute, please, could you just mute? There we go. I think I got it.
So just to repeat, because it's an important point, assisted suicide is made a rational choice when the person committing suicide has a disability. When the person does not have a disability, suicide prevention is offered. And so I previously mentioned our number in opposition. To that end, many are unaware of the fact that every major national disability organization that has taken a position on assisted suicide laws opposes them. Not one supports it. So to name a few, I think Susan mentioned ADAPT, AAPD, ASAN, AWNN, DREDF, NICL, TASH, the ARC of the United States, and of course, United Spinal Association. That's just to name a few. And so one of the distractions proponents like to use is this idea that opposition to assisted suicide legislation is isolated to conservatives. Well, it's also worth noting that none of the progressive major national disability rights allies are ever mentioned in their campaigns. This to say, disability justice is very much a progressive issue, and one where the entire disability community agrees that access to life-sustaining, life-saving healthcare is a human and civil right. So why is legalization of assisted suicide an affront to disability rights? Well, since 1997, after the Supreme Court in its unanimous decision, Washington v. Glucksberg for the train spotters, kicked the fight down to the states, concluding that there was no constitutional right to assisted suicide. And this, despite hundreds of attempts at passing assisted suicide bills, have failed and failed and failed since 1997. Our success in holding back this eugenical tide is made more incredible when we consider that this has been a grassroots to grass tops fight against a big money national campaign, and that assisted suicide is legal in only 10 states plus the District of Columbia. So this year alone, we, as I mentioned, we're 3 years running with no new states been acquired. I think it was 14 states we defeated, with a few more to go. So that's real momentum, unlike proponents' advertisement to the contrary. So this year alone, over 20 simultaneous states campaigns have pending legislation. Every proposed bill begins with the same promise that there will be protections and safeguards, and that the provision will be pinpointed for terminal illnesses only, for the elderly, for people with 6 months or less to live, always with great emphasis to be accessed in rare circumstances. But the opposite has been true in every jurisdiction in the world where there is an initial bill passed, to say nothing of expansion, which only ever occurs on the basis of disability. This to say that disability and disability alone is a rational reason, as mentioned, to pursue one's death with assistance. In Canada, we were initially sold the same bill of goods, particularly that it would be rare. More on that in a moment. So for nearly 30 years, the National Council on Disability has said that assisted suicide legislation is a deadly form of disability discrimination and has urged lawmakers to reject the proposals, arguing that no legislative safeguards could ever exist to make these proposals safe or compatible with disability rights. And I'm hearing Marilyn Golden and Diane Coleman in these forums as well. So they first predicted these problems that emerged in '97. They confirmed it again they confirmed predictions in 2005 and confirmed predictions again in 2000 in the 2019 bioethics report. And so that takes me to the first explanation of why legalization of assisted suicide is an affront to disability rights. So, having just passed the 34th anniversary of the ADA, and just a few weeks after scores of advocates marched in Chicago at the annual Disability Pride Parade, declaring on behalf of the disability community that embracing disability is an inextricable part of who we are and that we don't have to apologize for it. It's hard to imagine a way one could support integrity in one's identity as a disabled individual and simultaneously support a supposed healthcare policy that seeks to memorialize in statute that a person's disability is a justifiable reason for a doctor to actively assist in ending their life in a dark moment. So to take it a step further, most of you are, I'm sure, aware that in May of this year, the Department of Health and Human Services finalized an incredibly important Section 504 rule that prohibits healthcare providers from discriminating in the provision of healthcare on the basis of disability. And it was in direct response to the significant health disparities that people with disabilities experience, owing in part to prevalent ableism in healthcare that sees people with disabilities as having lives worth less than those without disabilities. It was also a response to the horrific crisis standards of care that we were all appalled by during the pandemic. I must never forget that the default position of many states when hospitals were full and medicine was scarce. Um, the systemic instinct then was to prioritize us last or cut us out of treatment outright. Why? Well, I guess they thought our lives were less valuable. Better off dead? Question mark. And that leads me to commercial break here to advertise Liz Carr's BBC documentary. I think the link is also in the chat. It's Better Off Dead by the same name. It's substantial. It's very good. Diane Coleman, whose opinion is always worth deferring to, has called it the best thing of its kind done by the disability community on the subject. It's fantastically powerful. But to that question, proponents say yes, that it's precisely what efforts to legalize assisted suicide hope to achieve under a retrofitted definition of autonomy, choice, compassion, and dignity in order to achieve certain definitional utilitarian benchmarks measured in quote unquote healthy corporate bottom lines. After all, these professional assisted suicide organizations aren't fighting for anything but assisted suicide for those with disabilities. They're not scientific bodies calling for cures. They're not medical authorities holding symposiums to improve healthcare systems for people with disabilities. They've invested, all of their robust resources away from life-saving, life-sustaining supports and services, and have done everything to divert attention from the disability community's real needs in their decades-long campaign. So by a bit of sort of incidental history, again, kind of a commercial break, but I think it to me it raises the hairs on my neck when I think about this. So someone will be familiar with the organization formerly known as the Hemlock Society. Well, they were known as the Hemlock Society. But while most of us, and again, this is kind of in the weeds, but a bit of a commercial break. While most of us might immediately think of like Socrates, taking the poison, what we should recall as it pertains to our purposes today in this issue is that Socrates didn't choose to commit suicide. He was compelled by the nation state Athens to carry out his own execution. That's not so far afield. You see, those who are eligible for assisted suicide in states that have legalized, they're all people with disabilities experiencing a variety of commonplace experiences that have solutions that haven't been prioritized, motivating the hopeless so-called quote-unquote choice made in dark moments to end their lives. And most of the American public is under the impression that people who seek assisted suicide do so because of intolerable pain. But we know that the Oregon data says otherwise. The reasons that they give over and over are experiences common to people with disabilities that have easy solutions to them if we only have the goodwill to do so. They're afraid of losing bodily control. They're afraid of burdening their family and friends, afraid of losing independence. In short, they're afraid of being disabled. And proponents, that is, and as is the case, they're the most vocal, most industrious of proponents, or those without disabilities, but who project their ableist assumptions into a future that hasn't arrived, but might. So in addition to the Section 504 rule, HHS finalized this year that prohibited disability discrimination and various healthcare provisions. In September of last year, the National Institute of Health also announced people with disabilities as a health disparity population, finally recognizing and validating longstanding research that showed just that. By virtue of the designation, NIH has promised to invest into more research into addressing and stemming those disparities. But make no mistake, when the American population is properly sensitized, proponents would like to expand it to include those whose disabilities are not terminal. Similar to those that happened in double quick time in Canada, and I think it was in 2021, where Track 2 was activated for those whose death is not reasonably foreseeable. And this was all, part of the plan. Quote. We know from Oregon's data that people without terminal conditions, anorexia, diabetes, hernia, etc., have already accessed assisted suicide prescriptions, but not because of fear of pain or death, as proponents repeatedly claim. That it needs to be repeated in messaging every chance we get. And in an environment where the recurrent message from government over the last year has been a recognition of the disabled's health disparities and record of discrimination in healthcare, legalization of assisted suicide is a legislative proposal seeking to normalize assisted dying as a quote unquote as a form of healthcare for people with disabilities. When Canadians have needed vital, timely, specialized medicine, they didn't and don't wait for the possibility of what might be available in the Canadian healthcare system. They come to America because they have the ability and the option to pay for it. The poor, whether Canadian or American, don't have the option to pay for healthcare that they would choose if they could choose. Um, and and it's interesting. I digress for a moment. I was in a Maryland this year when I testified in Maryland. I had a tete-a-tete with a proponent who, at one point, said to me that I underestimated the poor's ability to choose, which I found vomitous on any number of levels. Obviously, having never perhaps experienced what poverty means and the anxiety that goes with making basic decisions, whether for food, transportation to go get food, perhaps your lodgings are going to be compromised, any day. It's simply a different world from the wealthy and, dare I say, the white donor class that have an effortless existence and look at disability and their ability to snuff it out with the same type of peculiar, unusual ease. Call it ableism. But in other words, it's the presentation of a negative assumption about the value of a disabled life. In Canada, we're seeing the modern extension of this policy thinking, rightly compared to the Nazis, who also believed in a national hygiene program that first exterminated insects and vermin from German factories. Then there was a seamless justification, right? That was the first step. The next incremental step was to justify, along similar lines of genetic purity, the extermination of the disabled, and then those with other immutable characteristics. For anyone taking notes, it was called Action, spelled AKTION, 14F13. Tim Staton, director of University of British Columbia's Canadian Institute for Inclusion and Citizenship, called Canada's eugenical engine the biggest existential threat to disabled people since the Nazis' program in Germany in the 1930s. So for now, Canada is also with distinction in that it's the only country that has identified euthanasia as essential medical care and is presented as, quote unquote, objectively indicated medical care, where death becomes simply another tool to treat patients at the expense of patient-centered care driven by eugenicists in a profit-driven system, ultimately stripping patients of protections while empowering healthcare professionals to make the choice from their augmented toolbox and with impunity. This to say, assisted suicide promotes death for people with disabilities and sucks political out of where the true focus and discussions should be, seeking investments in long-term supports and services to make lives easier and better to live. So I'm terrified by the prospect of, my new American home marching toward what's firmly taken hold in Canada, especially this false notion of a one civil and human right to die, quote unquote, with dignity, where in a matter of fact, the only right one is the healthcare professionals' immunity from prosecution. So to illustrate the connectivity, what happens in Canada matters and influences what can happen here. In 2015, Compassion and Choice's then president, Barbara Coombs-Lee, celebrated the Canadian Supreme Court's decision to legalize assisted suicide, quote, saying, "We applaud and thank the Canadian Supreme Court for placing the patient at the center of fundamental end-of-life decisions." Going on to say, "We are heartened as the availability of aid in dying in Canada will have an impact here." That's the US. So, but what was lost in the applause was this excerpt from the fourth paragraph of the Supreme Court decision that notes assisted suicide for those with, quote, has a grievous an irremediable medical condition, including an illness, disease, or disability that causes enduring suffering that is intolerable to the individual in the circumstances of his or her condition. To place what the applauded in perspective, expansion has occurred in every American jurisdiction, and in California, the recently defeated SB 1196 employed eerily similar language, including removing the term terminal illness to be replaced by, quote, a grievous and irremediable medical condition. So that's a profound shift. Um, Predictable, though, because international players have shared a stated goal that's only fulfilled in constant expansion, but discharged incrementally as the public is slowly sensitized in the necessary conversation so as not to, quote unquote, discriminate against those, quote unquote, in need. Um, for those like Peter Singer, euthanizing those that are unaware of themselves or their place in society satisfies those, quote unquote, needs. Those that suffer from dementia, for example. And so here we return to Thaddeus Pope. He's an American bioethicist, and in his medical futility blog, he referred to SB 1196 as, quote, unquote, pioneering with respect to eligibility for, among other categories, people with dementia. Interesting for a number of reasons, not the least of which is the false and insistent claim by proponents that laws in Canada and the US are an apples to oranges comparison and have no bearing or influence on one another, or those laws that have initially passed in the States that will never, quote unquote, expand due to safeguards. Well, that same year, in 2023, that the Canadian 22, the Canadian Alzheimer's Association came out with support for Canada's program. The American Association, thankfully, came out and terminated its quote unquote educational relationship with Compassion and Choices, on whose dementia advisory board Thaddeus Pope sat. Interesting. Thankfully, in 2023, the Alzheimer's Association said research supports a palliative care approach as the highest quality of end-of-life care for individuals with advanced dementia. So, in other words, assisted suicide is a solution to a problem that doesn't exist because palliative care and hospice care do exist. So to continue in Pope's blog, he notes, the other potentially eligible groups like mature minors. So I'll pause here again to remind you of this terminological war. We wouldn't want to legislate the word, children. I guess, quote unquote, little people was taken at the time of the draft, and I understand the necessary implications of using that word. But it's a way to sort of sensitize the population to a different possibility and a different meaning, different connotations. Again, not unlike this false idea that legislation occurs spontaneously and a eureka discovery from state to state. Expansion isn't merely an option, it's protocol. And in every instance in which terms are set in initial legislation, their meaning is provisional, meaning terms like doctors and terminal are really expectant words waiting to give birth to their incoming offspring, like healthcare professional and non-terminal, until eventually whatever euphemism for assisted suicide is furnished, it's merely a placeholder for active euthanasia. And from there, I'm sure we might see in Canada in the not so distant future the quote unquote possibilities they might be. And so mature minors has been debated in Parliament for years. But remember, with two tracks, one where death is foreseeable and where it's not, the initiation of assisted suicide, euthanasia in the Canadian law tricked the eugenical engine to necessarily achieve greater and greater benchmarks, which by design is intended to saturate a healthcare system as a constant, cheaper option. And the possibilities read like a healthcare holocaust. Consider the peculiar relationship in present-day Canada in terms of its healthcare policies that attempts to legalize hard drugs, but at the same time, within the eligibility of mental illness set to trip in 2027, I believe there's a provision for people whose only illness is drug addiction. That seems a curious coincidence, I would think. That Thaddeus Pope is, a 2021 Fulbright Scholar at the University of Ottawa, which is for our attendants in Canada, as a research chair in health and food security, and that the name of his project was End of Life Liberty in Canada and the United States, Comparative Law and Policy Analysis, is also curious. Curious because I'm Canadian. I'm a Canadian fighting against legislation in America, because proponents repeat in workshops and in testimony that the comparison between Canada and America is apples to oranges. Like as though, the type of comparison legal analysis is like you're comparing the states to Afghanistan. It's incredible. But curious, given the obvious points of congruence of cause and effect in Canada, where grinding poverty, i.e. food insecurity, has and is pushing Canadians with disabilities into deferring to euthanasia.
Hold on.
Into deferring to euthanasia because necessary and timely supports and services are unavailable. I think if everyone can remember the name Jennifer Hatch, you can search her on YouTube. She was famous in Canada for 15 minutes because she was part of a national clothing store commercial campaign. The store's name is Simon's, S-I-M-O-N, I guess apostrophe S. And in it, she was in this sort of fantastical reality, dreaming of bubbles in another world, and repeating that you just have to be brave in order to get there. Well, she was killed by Euthanasia Canada, and there was a subsequent article in the National Post which said what she really thought and what many Canadians with disabilities obviously think, and that was, I wanted to live. And it occurred to me, there was a man in the Better Off Dead documentary whose name escapes me, and I believe he was saved. He was saved because he received, I think, $50,000 or $60,000. And it occurred to me, for this woman, this beautiful woman that died, that for the cost of a commercial, a 3-minute commercial in Canada, which I think is somewhere in the order of $300,000, she could have been saved 5 times over. How repugnant this whole enterprise is. And the truth is that the services are there. They're not being made available, while euthanasia is being made available, even on a day's notice. So really, although I think sometimes we like to placate the conversation with a kind of collegiality that never serves us, in believing that there is a sort of pragmatic reason as to why people with disabilities don't receive the healthcare they should, that it's a function of resources. I say no, it's not a function of resources. It's a function of bad will that has deprioritized and devalued people with disabilities. And so to push the example further into the light that Canada is absolutely in proponent sites, I, along with Anita and my colleague Jessica Rogers, who I don't know if she's in the room, was interviewed for a recent article in Canada Affairs. It's a digital publication, along with Thaddeus Pope, who was quoted as saying, quote, "I don't think the thing at the bottom of the slope is actually a thing to avoid, even if we were sliding there," he said. "I don't think we are, but even if we were sliding toward Canada, I don't think that's a bad thing." And so from his article, from his medical fertility blog, he further clarified, I quote, "argue that Canada is a model, not an anti-model." So for perspective, remember, we were sold, like every state is sold, that this is going to be a rare occurrence. Well, as of 2023, approximately 60,000 Canadians have been killed by Canada's eugenic healthcare program, quote unquote. As of this moment, if trends have continued, as they have over the last 5 years, that number is probably closer to 70,000. Euthanasia accounts for approximately 4% of all deaths, and it's climbing, even without mental illness as a sole criterion for eligibility, set for activation in 2027, with other categories pending approval. So when I say healthcare holocaust, I'm not being hyperbolic. The possibilities are truly terrifying. But we were promised safeguards too, and that's the point. Provide enough attractive information presented as a progressive argument for autonomy, again, to actual civil rights, in order to gain the foothold in the legislative door. You sensitize the public each step of the way until the initially promised quote unquote option is the default choice, owing to a reduction in resources and timely supports and services, until a person who would otherwise live applies to commit a once inconceivable act of self-harm and calls it a cure. Said differently, paying into a healthcare system that has been re-engineered to hunt the most vulnerable rather than save them. Said differently, what proponents note as the right to die quickly reveals itself to be the expectation of enterprise that sees the disability community's duty to die, a kind of disability privilege in having won the genetic lottery to offer ourselves on the altars of the system. Eugenics, in other words, is improving society in general by selectively killing the weak and undesirable, however defined those terms might change in order to fill the intended goals. And so in this instance, our American instance, Canada matters because our concern is the American statutory map and our continued efforts to amplify the need for positive outcomes and the removal of disability bias as the government's taking steps to. We're thank you, and it's kind of like a big "we told you so," in order to take hold of and keep the keys to robust healthcare policy for all, where people, not profits, are prioritized. With assisted suicide, there is no coexistence with healthcare justice and a bright future of medical technologies that will enhance the lives of people with disabilities and certainly pave the way for society where people with disabilities are full citizens with all that citizenship entails, with communities fully alive because they are fully accessible and fully inclusive. Assisted suicide is antithetical to disability rights. It forecloses choice. It memorializes in statute that having a disability is a rational basis to seek assistance in suicide. It creates a two-tiered system in suicide prevention in which those who express suicidal ideations don't have disabilities get suicide prevention services, while those with disabilities get assistance. It regressively time travels us back into pre-civil rights days and is incompatible with all modern disability health policy developments of the last year. And this fight was brought to us. This fight isn't brought to us. This fight brought to us isn't about our freedom. It's about their greed and ableist ideologues pushing for a national system aligned with big money insurance company interests that prefer profits over people. Excuse me. It's a fight with those who use their means to insist we're better off dead. So, to repeat from the outset, if there's one thing to take away from this session, it's your voice, your testimony, your engagement matters in repelling the concession of proponents who agree and affirm in conversations across the country that the policy premise that allows for illegal assisted suicide is that there is such a thing as a rational suicide, but only if you have a disability. So, before I hand things over to my much more capable colleague, Anita Cameron, I'd like to close with a quote that I used in my testimony in Maryland earlier this year from a proponent, a Washington, D.C. Compassion & Choices DEI advisor, the country's largest assisted suicide activist organization, that I think concisely illustrates the obvious injustice at work in their enterprise in their own words. So this is from, I think it's a February 7th article from Maryland Matters. Last name is Smith, and he says, quote, "I know in the Black community, we're still fighting to live. We don't get adequate health comes to begin with. So it's hard to say, okay, let me offer you this option when you haven't been given the support you need to live." Sound familiar? But it shouldn't be hard to say. It should be impossible to say, because it's an obvious moral failing to offer society's most vulnerable the cheaper option to die when you haven't lifted a pen to fight for better, cheaper healthcare in order for them to live. And with that, I thank you for your attention. And without further ado, Anita Cameron. Anita.
Thank you, Ian. And thank you, everyone, for having me. Again, we're on the road, so please excuse the dead zones we may go through. So again, my name's Anita. Hey, I'm going to give a brief description just for access. It's something I do. I am a Black woman with caramel colored skin, long locks, have on a white kind of fishing cap, and a gray and purple hoodie. I am director of minority outreach for Not Dead Yet. And I came to Not Dead Yet through ADAPT. And I was actually involved in Not Dead Yet from the beginning, but it really kind of came home to me with the story of my mom. My mom was living in Washington State. She had been living in Washington State for a few years, but at the time that I received a call from her doctor Washington State had just enacted its assisted suicide. Called me and said if I wanted to see my mom alive, that I needed to get to Washington State in 2 days. So I did. My mom rallied, but she was later placed in hospice. And she was in hospice for 6 months. And during that time that she was in hospice, her doctor had her convinced that she was dying, had me convinced that she was dying, did everything short of actually offer my mother to take advantage of their new literally thought she was dying, and so she left hospice to go home to Colorado to die. We made those arrangements for her. But my mom had a bucket list, and one thing on her bucket list was to get arrested with her kid, and I were arrested together in Washington, D.C. on an ADAPT action. At that point, she decided that she was not dying. And she became very active in her community. And my mom did pass away on February 1st, 2021, but it was 12 years after she was, 12 years after I received, that harrowing call. And I tell that story because that was how it came close to home for me. I had already had a Olmsted civil rights complaint against the state of Washington anyway for not, getting my mom the home health care and other services and supports that she needs. So this situation, assisted suicide laws, they say that you have to be terminal, 6 months or less to live. And my mom's case, it proved that doctors are often wrong. Obviously, my mom's story is not the only story, of people who are slated, who are determined to be terminal, and then, they outlive long past. What I'm going to do is I'm going to read you some excerpts from an article that I've written. I write a lot about racial disparities in healthcare. I've said for quite some time, certainly the last 7 years that I've been working for Not Dead Yet, that as assisted suicide is normalized across the country, then we're going to start seeing, because, at this point, it's 10 states in the District of Columbia. And, oftentimes those of us who are against assisted suicide, we get poo-pooed by the proponents because it's like, what's this stuff you're saying that's going to happen? For instance, in the Black and Latina communities, according to a Pew Research study, we're 65% against assisted suicide for any number of reasons, mostly cultural and religious. I've watched proponents, unfortunately, come into our communities and spread the lies, spread the farce. And unfortunately, because of ableism, a lot of the civil rights organizations like NAACP and all don't really want to work with us. They prefer to work with Compassionate Choices, and in fact, they did, and came up with a and assisted suicide is not end of life care. Assisted suicide is taking some medication and ending your life. It is not end of life care. End of life care is giving you all of the supports, the services, the healthcare that you need to, that as you, are entering into, the final parts of your life, that you're doing that with all the services and supports that you need while that dying process takes place naturally. So let me, I'm going to read you because it's got, lots of statistics, and I'm going to read you a little from this because I wrote this in the context of New York has an assisted suicide bill that came out. Thankfully, we defeated that, called A995. And here in New York, at the same time that they had that going on, we had cuts to our home health care programs taking place, difficulties and pain, attendance, that. So let me kind of read that because I don't want to go off on tangents and bore you and all. So it's access to healthcare services and supports are being stripped from disabled New Yorkers. And this is happening across the United States, not just in New York. We cannot push forward with A995. Cuts to funding for home care services, as well as reduction or elimination of eligibility to those services, combined with racial and disability disparities and discrimination in healthcare, will lead to those being deemed to be terminal to feel that they have no choice but to ask for assisted suicide. Lack of access to home caregivers due to workforce shortages, with workers unable to work enough hours and earn a livable wage, will further compound this. Because if you need, personal care services in the home and you can't get them, what's that gonna lead? And unfortunately, here in the state of New York, I'm personally affected by some of this stuff. So I was really glad that we dodged that bullet of our assisted suicide laws. So proponents say that assisted suicide is for those that have 6 months or less to live. We know doctors make mistakes, a lot. And how many of y'all have heard of people outliving their terminal diagnosis by years or even decades? I'm sure, many of y'all have. I just told you the story. My mom lived 12 years past. So assisted suicide laws, they put sick people and seniors and disabled people at risk due to the view of doctors, that disabled people have a lower quality of life, therefore leading them to devalue our lives. And so at the end of 2023, the National Institutes of Health designated disabled people as a group that experiences health disparities. I don't know why it took them so long. Certainly our community could have, easily told that. So in 2021, Lisa Iadzoni, a professor of medicine at Harvard University, she conducted the survey of 714 doctors around the country. She was doing it as part of a study. This professor actually uses a wheelchair. She was going through medical school, got MS at the end of going into medical school. And so he said she was working on this study. She set up this Zoom. She set herself in a position to where you really couldn't tell that she was in a wheelchair, which allowed these doctors to be very, very honest to her. Okay? Just giving you that context. She found that 82.4% of these doctors reported that people with significant disability have a worse quality of life than non-disabled people. Let me repeat that. 82.4%. Like, That's like almost all doctors. Like only 18% of doctors don't believe that, and really less than that, you know. So only 40.7% of physicians were very confident about their ability to provide the same quality of care to their patients with disabilities. Just 56.5% of these doctors, they strongly agreed that they welcome people with disabilities into their practice. Wow. And 18.1% strongly agreed that the healthcare system often treats disabled people unfairly. 18%? Really? For real? Wow. Wow. Okay, so now let's talk about racial disparities for a minute. And some people may ask, how do racial disparities relate to assisted suicide? So the researchers documented that Black and Asian and Hispanic patients regularly experience barriers to palliative care and hospice care utilization. We receive barriers. A 2016 Journal of American Medicine Association, they did this internal medicine study. And they found that hospice patients were less likely to be visited by staff in their last 2 days of life if they were Black. Yeah. And even more alarming, California, this is happening in California, I'm pretty sure it's across the country. California nursing facilities with higher numbers of Black and Latino residents have had higher rates of death. So, although Black people and other people of color request assisted suicide less than white people, far less than white people. At this point, as the practice is normalized, we're more at risk of pressure to do so. First, because the racial disparities in healthcare leads to limited health choices for health outcomes, including death. Economic disparities, it makes it less likely that we can afford life-saving treatment, more likely that doctors will write us off as terminal and thus eligible for assisted suicide. Research also shows that Black patients are less likely to receive adequate pain treatment due to false beliefs about biological differences. Yeah, there was this 2016 study that showed that 1/3 of it's like 222 white medical students, doctors, medical personnel believe that Black people had thicker skins like animals, and therefore we could withstand pain better. And obviously that's untrue, but those types of those thoughts, those stereotypes leads to biases in the ways that doctors treat us, not only as their patients of color, but also add disability into that. And that's magnified. So, because the proponents often talk about pain, that's their thing. It may sound harsh what I'm about to say, but they do the whole bait and switch because they talk about, pain and witnessing family members and all having terrible deaths. And we don't want to see that. You know what I mean? Our empathy and our compassion comes forth because we don't want to see that happen and we don't want to experience that. But the Oregon data shows, as Ian was saying earlier, something totally different. And
Anita?
I do
Anita?
want to talk.
I just want to
I'm
break
sorry.
in real quick and just remind everybody to get their questions ready because I just want to be mindful of time, so that you guys don't take too much time out of your evenings to answer questions. So we're going to open it up to the conversation in just a minute. I'm absolutely finish up, Anita. What you both presented has been phenomenal, much needed information to get out there. So really do appreciate it, but get your questions ready. Raise your hand if you'd like to ask them. And if Ian and Anita would stay around for just a little bit to answer some, that would be amazing. We'd really appreciate it.
Sure, I'd be more than happy to stay around. And I'm just gonna end this by saying, because the question was, what's gonna happen in our healthcare system if assisted suicide laws are passed? Now, we're slowly normalizing this around the United States. And as we're normalizing this in the States, then that's where you're going to see the disparities come into play. The racial disparities that are well documented in this country, the disability disparities that leads to disability discrimination in healthcare, because wait till the next COVID comes up and people with disabilities will once again be at risk of these crisis standards of care that say our lives aren't valuable, allow us to die, while others live. And so what I've been saying, and I will say before I go, is you will slowly see the results of disability discrimination and racial disparities push people. You don't have to, a doctor doesn't have to come out and say things to you. They don't have to come out and make it, in your face. They could steer you. They could tell you there's nothing more that we can do. They can tell you, come on, you could have seen this coming. So that's what's going to happen. And that's why we're working, here at Not Dead Yet, Patients Rights Action Fund, DREDF, and all these other organizations to put a stop to, the passage of assisted suicide legislation, because, things rarely happen, right there at the blink of an eye. You have to unfortunately live under things for a while for things to start showing themselves, for you to start seeing what's going to happen. And so that's why we don't want to get to that point.
So
where
I have a question that because I've been listening to you folks, that you really so much information. I can hardly take it in. I love it. It's like perfect. So here's my question. How does this, a lot of what you talk about, your experiences like with people with physical disabilities, and a lot of the people who also get on here have, I don't know what to call them anymore. I really hate these labels, psychosocial, mental health. That how does for both you and your partner, Ian, how does that relate to people specifically who have kind of mental health? And we know that the same thing is happening there. So any thoughts about that, either of you or anybody in the audience? Because I think we need to open it up to the audience. But I'm an audience. That's my question. Thanks.
Susan?
I think people with those lived experiences, I'm going to include myself because I live with depression. I've been in and out of hospitals. I've been a person with physical disabilities in a situation where I wanted and needed inpatient mental health. And because of my physical disabilities, I was considered a liability and could not access that service. And so that happens a lot. These laws are going to be really detrimental to those of us with that lived experience, because they can catch us, in a bad place, and then we can be steered towards that. Doctors rationalize what happens to us out of their ableism, and so that's why I believe that as those of us with that lived experience, we really need to be fighting this.
I'm not sure. Are there people in the audience who want to speak to that?
Or is there any questions?
I think one of the things that happens when people acquire disabilities is they can go through a stage of depression and grief where they can't perceive at that point that they want to live any longer with that disability. And so while they're still in that state of shock and grief, if assisted suicide were available, there would be a lot of people with brand new disabilities that would be making that choice. But you give them 6 months, they wouldn't make that choice.
You give them what they need. You give people the services and supports that they need, and they wouldn't make that choice at all. I mean, I hear stories all over Canada about people, being, directed toward euthanasia because they can't find, affordable, accessible housing. They can't find the help, they can't get access to the health care they need and whatnot. And as soon as some of them get that access, then they don't want that. And that's what's going to happen here. That's often what happens. Not only when you are diagnosed with a new vulnerable place, and that includes even being diagnosed with a new, lived experience of psychosocial disability, still. And that's why I feel like we really need to be diligent in that because, to me, those of us, in the disability community, those of us who do have psychosocial, experiences and whatnot, we're going to be particularly at risk.
I would, you know
I
what?
see 3 hands. Holy cow.
So do I. I was just absolutely. So Susan, whose hand did you see go up first?
I see Scott, James, and Joan. Yeah.
And Ian here for a moment.
John Kelly was originally going to be one of our speakers.
Yeah, I'm
Oh, okay.
I'm here and sorry I can't figure out how to get the video going. But I could speak a little bit to being that kind of the classic moral case for euthanasia and mercy killing, which is being paralyzed from the neck down, as they say. And so whenever I see myself on screen, you can be sure I'm clamoring for my own death. And so at some point, I think I do want to watch Me Before You, maybe with a group like this, or to somehow conquer it, because I've never watched it. And I think it has a little bit of power over me because after I was injured, I was very depressed, but it was people who gave me love and support. And then I got opportunities. And those are the 3 things I think you need. And people can thrive in really just about any circumstance at all.
Okay, hands up.
Thank you.
Scott. Thank you. Scott and James.
You want me to go?
I see Scott first and James. I'm just going what I see on my screen.
I was born with, there's a fancy phrase now, invisible disability. Sometimes the signs of problems in people physiological signs are visible if one looks. My best friend was a biologist, passed away. All I can see is that this assisted suicide, it's going to do nothing. I study history. I was not allowed to complete high school. Theoretically, I'm somewhere on the autistic spectrum, which you didn't even hear about when I was a child. I'm 70 now. You know, I study these things. I was allowed to learn how to read. And believe me, many people who do know better treat me as if they treat me as if I don't know how. But I do. I have no degrees. I don't have I've got a GED diploma somewhere. Because of the physiological symptoms, I was never allowed to pursue a proper education. And again, the system has a way, bureaucracies have a way, which is what the system really is, it's bureaucracies. And they have a way of covering their own mistakes. I see one of the problems is that people, when I was younger, there was a movement that died out somewhere in the 80s. It began to peter out. It petered out by the 90s. To say not, well, we are mentally ill, or we're labeled mentally ill, but our problem isn't mental illness. There's a physiological problem. It leads to eccentric behavior, or there's just plain something that the system doesn't want to deal with. So they label us mentally ill because the mental health system is a catch-all. Maybe people, instead of thinking, I'm mentally ill, but I want to be treated right and I want proper treatment, maybe they should think, well, being depressed, being angry, if you get locked up in a mental hospital arbitrarily with the very Bill of Rights that farmers gave their lives for, abridged, put aside, yeah, you're supposed to be mad as hell. That's called normal.
Right? Scott, you make a great point. I just want to make sure everybody gets a chance to speak, but you make a great point because that's exactly how several other people before you kind of echoed that's where a place where I think all of us can really unify because, you know, walking with a disability of any type is not a simple task. And we all feel the burden and depression and sadness and different things. And it gets very misunderstood. And so I just want to make sure that everybody gets a chance to talk. James had his hand up. James, would you like to share? We can't hear you, James. I'm sorry. James, we're not hearing you. James, we're not hearing you, so we're going to have to go to Emily and then get back to you when we can hear you. Emily, would you like to share? Your hand was up.
Yeah. I just wanted to say I appreciate all the presenters today because this is not a topic that is usually talked about. I facilitate support groups, and one of my friends that I met through my support group, she recently was sharing how she has so much physical pain that it made her feel like she wanted to do assisted suicide. But in our support groups, because one facilitator openly shares, oh, I'm a mandated reporter, so so if you share something, then I have to report what you share. So she even openly said, like, I'm not going to share because of that. Mandated reporting is very controversial, and I feel like the training is not all there because there's people overreact and they make too many misunderstandings, assumptions, and I find it quite sad. I'm also involved in cat rescue work, and I was so sad when I had met one cat rescuer, and she was doing so much work to help all these kittens and cats get adopted and doing her own nonprofit work, but she had so many physical ailments that she ended up dying by suicide. And because the physical pain was that great. So thank you so much for these discussions. I appreciate this. Thank you.
Thank you. We
This
appreciate it.
Anita, if we would fight for access to pain meds, access to palliative care, which is not just for terminally ill folks. If we did that, you know, that's what I tell the proponents, you know, if you're afraid of pain, fight for better access to that so you won't be in pain. Don't fight assisted suicide. Thanks.
Thank you so much. Is there any other questions, comments, feedback, James?
I see a hand up for James and
Yep.
Alex.
Let's see if James and is your mic working now, James? And then Alex, you can speak right afterwards. I don't think it's working.
Ian here. While James we're figuring out audio issues.
Yeah.
I just wanted to ask if Scott could come back on and finish his point. I believe he was just at the point of making a point that he wanted to make. If that's okay.
Of course.
Well, thank you very much. Oh my God, my phone, I've got to turn it off. Okay. If I can capture my thread, right now, you know, in many areas of this country, housing, which the Americans with Disabilities Act guarantees be provided regardless of disability. You cannot, according to that law, reserve it for consumers of mental health. If you do, you are committing a criminal act. And I would assume that the present leadership of ADAPT is not anxious to bring up that point, but that's another issue. The fact is that I was forced to move here to Vermont, where because of a juxtaposition of circumstances, I cannot get accustomed to exercise. I know how strange this must sound, but we don't have time for an explanation. I can assure you, I may be KREZEE, but I'm not STOOPIDD, and I'm certainly not irrational. People, all kinds of people want to cry over the mentally ill homeless. I volunteered with homelessness as way far back as '87, and I saw then it was not caused by drug addiction. It was not caused by mental illness primarily. Rather, it caused people to become confused and out of their minds. It made them turn to drugs. And I saw that it would get worse. And sure enough, it got worse, which any fool could have seen. But any fool, it took this fool here to see it. And my point is, you know, that we overemphasize mental illness to the point where it has driven up the cost of housing, because every unit of that housing reserved for the mentally ill has the bill of some kind of treatment tacked onto it.
Hey, Scott, you are amazing in understanding all the intersectionality between, we're talking about housing, we're talking about rights. I love that you do that, but I have 3 hands here, and I love you. Seriously, put it in the chat. And how about James? And then I think Alex and Anna. And stick with us, Scott. We're not hearing you, James. Can you take your mute off? Otherwise, we're gonna move to Alex. James, can you get your thing on, or you? All right, so for the moment, I think we need to move. Oh, wait, am I hearing something? Take your mute off, James.
James is in the UK, so I know that there's a time difference too. So I'm hoping he can get his mute off and share.
Okay, so let's go to Alex then, because
Mhm.
Alex, and take your mute off, Alex.
Yeah, thanks. So I joined a little late. I appreciate all the information. This is very new to me. I've been surrounded by people in the advocacy space who have been advocating for assisted suicide, and I understand that the focus, from my understanding, is more on people with mental health issues and disabilities. But I'm curious for people like my friend who's in her early 30s, who's been suffering from multiple incurable illnesses for most of her 20s, and has a couple weeks to live, and really wanted assisted suicide for many years. What's to be said for someone like her in her situation?
I'm sorry, this is Anita. I do not believe that assisted suicide is a good thing for anyone. And I'm just going to put it like that. It's not good for anyone. There are no people that it's good for anyone. There are no carve-outs in the disability community or anything like that. I live with level, we ain't even gonna say 10 pain, level 15 pain every waking minute of my life. Every waking minute. I have multiple disabilities I was born with, disabilities that I acquired. I have 3 different disabilities that's gonna take my life, literally, that's gonna take me out of here. And I do not want assisted suicide. We need, on the behalf of your friend, please, fight for better access to health care, fight for better access to palliative care and palliative sedation where they're not in pain. Fight for that access, because the thing about it is it's ableism. That's what's driving these assisted suicide laws. Ableism and messed up ideas and thoughts about what you think autonomy is. So but the thing about it is a lot of times people don't want to hear this. A lot of times people are so in their pain, in their physical and mental pain, and all of that we are thinking of ourselves and we're not seeing the big picture of what these laws do to entire communities. And so that's what I want to, put out there. As much as we're thinking about ourselves, think about the entire communities, and that these laws never, ever, ever are what they intended to be. These laws never, ever, ever have any safeguards, or anything like that. These laws, by their very nature, are discriminatory and they harm.
So, Anita.
I appreciate that. I don't know if you have an email address. I'd love to ask you a couple of questions offline if possible. Thank you.
Anita, wow, I love your passion and your honesty. And so much of this comes down to language and euphemisms and what it really means. So I always want to recognize that. Thanks for your question, Alex, and I hope you all connect in. And I think we got Anna next, am I right?
I think James said his mic is working, so I'll let him talk first.
I hope so. Can you hear me? Can you hear me now?
Yes, we can.
Oh, good.
Can you hear me now? I love that commercial.
Okay, great. Yeah, I was just gonna say that the thing about language is it's a little absurd to expect everyone to communicate in exactly the same way. Some people also are still maturing into their peer group's communication style. And so my concern is that people will be talked in to this assisted suicide program by manipulative operators trying to meet their quotas. So, you know, they can sort of do a slippery slope conversation where they say, do you ever feel depressed? And sometimes, and then say, oh, well, that means you have depression. And it's just sort of a linguistic trap. And that's unsettling because some people can fall for that. And it's sort of out there. And it's a shame because, you know, some people aren't exactly mentally ill. They've just, you know, found themselves in a situation where they're merely naive and they're trying to acclimate. So it's sort of rushing everyone through the same Procrustes bed, and that concerns me. So I thought I would let you know.
Wow, that is like profound, really, because I think about that a lot myself. It's like we've made, you know, we used to have normal, and now we have normal. And if you say, I feel depressed, suddenly you're clinically depressed. I mean, I don't even, you know, so that was really profound. Thank you. And I think
I do believe there's a book now called Saving Normal, if you wanted to look into that. The DSM.
I do.
Yeah,
The DSMV was considered too stringent and also.
that's
And
right.
so I'll let you get on. Cool. Thank
I
you.
love it. Thank you.
No, thank you, James. That was awesome. Was Anne next, I believe? Anna?
I
Yes,
did put my email in the chat. If anybody
can you
wants
hear
to.
me?
Yes, we can. Thank you. And thank you, Anita, so much. We appreciate it.
All right, so I waited until the end, but this was really informative, and this is something that I was really looking forward to hearing about because although I live in the United States now, I'm originally from Canada, and I've been following this increase in the MAID and assisted suicide, and it's been really concerning. And I try to sound the alarm on the eugenics implication as it was talked about. And I think it's also very personal to me because there was a time when I was extremely suicidal, and I genuinely thought this was an option that if it were available in that moment, I would have considered it. And I'm really glad that I didn't do it because I was able to recover and I'm no longer suicidal. And to think that in that moment, someone would have been, if that option is available, then they would have died. And then it's irreversible and it's genuinely scary. Just the idea that it would be expanded to be covering mental health issues as well. And I just think, yeah, so that's definitely dangerous. I think, especially for me, like one of the reasons why I was considering it was because as someone who's a psych survivor, I experienced the fear of opening up about being suicidal because when I opened up, I had the police called on me as a child. I had the police call on me for wellness checks. I've been forcefully institutionalized and drugged. And so that trauma kept me from opening up. And so for a long time, it really just felt like because the psychiatric system was so broken and it failed me so badly, when in reality, my issue was that I was traumatized. I was abused at home. And so the issue was that I needed to recover from my trauma. And once I did therapy to reprocess my trauma, a lot of that suicidality just went away. And it is hard because it's like, if I was in that moment where I said, oh, the issue is me, I'm just mentally ill or whatever, I decided to internalize about myself, then I would have thought that, you know, like assisted suicide would have been an option. So I'm really glad that wasn't an option and I didn't get pushed in that direction because I would be dead now if that were an option. And so that's why I also think so definitely the mental health care system is so broken and it feels like either you're abused in the mental institution or you have the police call on you. And it's especially hard because I hope everyone knows about Sonia Massey, a Black woman with schizophrenia who had the police come to her house and then kill her and then call her crazy after she died. And as someone who was diagnosed with schizophrenia myself, it was really, really horrible and painful to read about it, just how much the state and the police fails people with mental illness. And yeah, it's by design. It is really by design, especially the intersection of racism and ableism and satanism, it's especially hard to read about. And yeah, exactly. And unfortunately, some people get pushed where if that were an option, they would just go for it. They would take the assisted suicide, but it's the system is broken. And for some people, that's what they see as the end. But we need to really stop this assisted suicide thing. It's just genuinely horrifying. And I could have been a victim of it.
And Anna,
And so,
you
Ian,
also,
Ian
I
here,
have
can I?
to say here, I need to jump in here. So Anna, you just brought up our next Judy's room, which is going to be when people call for, when you call for help and it ends in death, which is exactly what you just spoke to. And we did part 1 a couple of months ago. We're going to do part 2 in September. I hope you join us and everybody else, because this the police don't know what to do, and but this is going to be a great conversation. What we're having is a great conversation, and the next one's also going to be great, when calling for help ends in death. And I know we got a hand over here, so I'll stop.
So, Anna, if I may, you mentioned you're from Canada. I'm a fellow Canadian living in the States. I put my email, oh, there's an N missing. That's Ian at Patients' Rights Action. Which state are you in? If you can contact me, I think having more Canadian voices in America with experience in the Canadian healthcare system, serving as canaries in the coal mine, with personal experience, is a very valuable thing. And so, whatever state you're in, as was mentioned at the beginning of my talk, the imminent need to engage with lawmakers, wherever your constituency is a material need that you can participate in and actually make those changes. And then within that, your testimony, you can witness to the need for positive supports and services, and begin to fight the positive angle of this obviously negative development.
We need to share our stories wherever we can to fight what the government's doing to us, for sure. I think Elaine wanted to share, right?
Yes.
Yes. This is Anita. I put a link to the website for Not Dead Yet in the chat, so that you can read more about this, all kinds of stuff on assisted suicide, and also on utility stuff, and whatnot. It's Not Dead Yet fights against all those forms of euthanasia and genocide. And there's also grab that 2019 National Council on Disability report. It actually references my mom's story, and there are a number of citations for some work that I've done, including on the criminalization of pain, and how the criminalization of pain leads to more people, being forced to ask for assisted suicide. So thanks.
I just want to highlight, Anita, that Ian, thank you so much for putting that in the chat. So if somebody was asking, actually a large number of people were asking for that link to that article. So it's in there now. And I just want to thank everybody that shared. I think this was a super important, valuable, greatly needed conversation that I think is just getting started. So getting that information out there, asking the questions and connecting. So appreciate everybody putting their emails in the chat. And I think we're gonna end the recording now, and we're gonna stay just a little bit longer. I know that Susan Fitz and I are gonna stay on and hang out for just a little bit, and we're gonna
sing,
absolutely, you can
Please.
sing. We would
Elaine's
love
got
it.
a hand up. Yeah.
I've had my hand up.